Hello, my name is Marissa Boddicker and welcome. I'm a first year midwifery student. Today on an antenatal visit, our lady Gian complained of feeling quite nauseated, experiencing constipation and vomiting. So we're going to be looking at some of the common complaints in pregnancy. So first of all, Gian has said that the foods and beverages that she usually enjoys are now leaving a metallic taste in her mouth and are making her feel quite nauseated. She's having difficulty in passing stool and it's becoming quite painful and uncomfortable for her. So first of all, Gian, I'd just like to reassure you that these things that you're experiencing are quite common in pregnancy. Something like 80% of women who experience nausea report that it lasts all day. It's been called morning sickness. The research that has been done into it has looked and discovered at least two positives, if I can use that word when referring to morning sickness. But one of the positives seems to be that the women who experience nausea have a less reduced likelihood of experiencing a miscarriage in this pregnancy. And there also tends to be a protective mechanism. That is to say that certain foods and drinks become unappealing, and it could be that those foods and drinks may have an unbeneficial effect on the baby, maybe even a dangerous benefit, so it's warning the mother to keep away from those things. During the first 3 months of pregnancy, obviously there is a huge amount of hormones being produced to protect and maintain this pregnancy, and it's during this phase obviously that there's a lot of developmental happening for the baby also. One of the main hormones that seems to be at the center of the nausea and vomiting is called HCG, which stimulates estrogen and progesterone production, which is responsible for maintaining the pregnancy. So a couple of things that we can look at doing to help reduce the effects of nausea and vomiting, and this information I have gleaned from a couple of websites that I'll write down for you. A couple of things we can do is having crackers or plain biscuits and eating those before getting out of bed in the morning. Drinking ginger tea, which apparently has quite a good effect on reducing nausea. Eating small meals frequently throughout the day, then having 3 large meals. Looking at having a well-balanced diet, high in fruits and vegetables, nuts and grains. Trying to maintain a good oral intake, using water rather than fizzy drinks and coffees and anything with high caffeine or additives. Some gentle exercise. In regards to constipation, again it's as a result of the hormone progesterone, which has a very relaxing effect on the smooth muscles of the digestive system. So food sits in the digestive system a lot longer, water is taken out of that food, making it a lot harder and drier and therefore more difficult to pass. Again, a couple of things that can be done to help minimize this effect is again keeping good hydration, using water rather than those fizzy drinks, having a good high well-balanced diet in fruit, nuts, vegetables, high fiber content. I think you said once that you quite like yogurt, so maybe using yogurt with a high bifidus content. Again, exercise would be quite good, and using fruits like kiwi fruit and prunes, which are natural laxatives, might be quite beneficial. The things I have outlined for you, you can glean from those 4 websites that I have will just mention to you now, and they are homecuresthatwork.com, premed.org. The Ministry of Health has an excellent website for pregnant women and breastfeeding mums, and another website is Domenti. These I'll write down for you and you can look them up also. So I know that you want to try and keep this pregnancy as natural as possible, so go ahead and try these things and give us a call and let us know how you're getting on. If you think that you may need a bit more support, the midwife then could chart some pharmaceutical products to help support you through this time. Have you any other questions? Great, thank you. So during this presentation we've looked at nausea and vomiting, commonly called morning sickness, and also constipation. The information that I pass on to Gianna has come from the 4 websites that I will include into this presentation, and also from Rankkin's textbook on physiological childbearing. This concludes this presentation. Thank you very much.